Good afternoon, Rhode Island. It's a beautiful day today. I hope everybody has a minute to get outside, go for a walk, take a breath of air, exercise. Spring is finally here. It's a great thing. I'll begin, as I always do, with data. You can see the data that's on the screen or soon to be on the screen. By and large, it's a good news story. You know, as you can see, the trends, flattening out of hospitalization and cases. We've had another 281 cases. So I'm feeling a sense of confidence that all the decisions we've made have enabled us to keep Rhode Islanders safe. We haven't seen some of the really painful experiences that others have faced around the country or around America, around the world. And it should give you a sense of accomplishment, really. I mean, this has been rough. This has been a rough couple of months. Our lives have been utterly disrupted. But I hope when you look on the screen, you feel like you have played an incredibly important role in keeping Rhode Islanders safe and healthy and alive and sustained and supported as we together as a community have lived through what could be quite possibly one of the most difficult things we'll ever live through. So I feel good. In the context of COVID-19 crisis, I feel good about where we are, and I hope you take heart in that. There are a million heroes out there right now in Rhode Island doing the right thing every day, no matter how difficult it is, and as a result, we're doing much better than a lot of states, and you should know that every time you've washed your hands, stayed home when you were sick, not gone into the office, paid sick leave for your folks to stay at home if they were sick, worn your mask, you have directly contributed to making Rhode Island a healthier, safer place. So I share that data as a glimmer of hope because I think it speaks to what we've been able to accomplish together. And I'm proud of you, very proud of you. I think by now we've all realized that going back to work is definitely not going back to normal. And each day I've been trying to talk a little bit more about what the quote-unquote new normal is going to be like. I'm doing it a little bit at a time because it's going to take a while to sink in. You know, I still think there are people out there who feel once I lift the stay-at-home order, it's just, you know, business as usual. And I want to be crystal clear, that is not the case. That will not be the case. Whatever phrase you like, slow and steady, you know, dipping your toe into the water, we're going to get you back to work. I am 100% committed to get folks back to work and to make sure that at the other end of this, our economy is even stronger than it was when we went into it. But it will take time, and it will require a lot of patience, flexibility, and frankly, rule following by all of us. It's also going to require a lot of creativity, flexibility, and innovation. If we're going to get our economy going again and our kids back to school and come out of our homes and go to the beach this summer, all things that I believe we're going to be able to do, we have to embrace new ways of living our life so we can live with the virus. And that means being creative and being flexible. And it also means keeping yourselves informed, which if you're listening to this conference now, you're clearly doing that. But, you know, the information is important because as you learn more, you can adapt your way of living, you can adapt your business, and really it's the best way that we're going to get through this. The best way to get through this is to really accept that the virus is here to stay with us for at least a year until there's a vaccine or a therapy. Accept that we are going to have to live within new limits, which none of us really likes. Not fight that fact, but start to get creative and figure out how to live our lives and run our businesses with a new set of restrictions. And I know we can do it. I know my money is on the people of Rhode Island. I feel that I am leading from a place of confidence and trust in the people. And that's why we are doing such a good job, and we're in the great place that we are now. Relatively great. So, how have we already changed our lives? We wash our hands all the time. I have a bottle of Purell on my desk. I go through a bottle every 2 days, and it's a big bottle. Washing our hands constantly for 20 seconds, using hand sanitizer, cleaning high trafficked areas much more frequently, not sharing pens or household items, and maintaining a social distance of 6 feet. These are some of the many ways we've changed our lives. The other way we've changed our life is that we're all wearing our cloth face masks. A couple of weeks ago, I signed an executive order directing all employees in businesses to wear their cloth face mask whenever they're at work, and requiring employers to provide these masks in the case that their employees can't make one or procure one. As we enter phase 1 of our economic reopening, in order to keep us all safe and frankly very aware of the fact that the virus is still with us, we're going to have to do better with our face mask wearing. So later this afternoon, I'll be signing an executive order directing everyone in a public place, whether that's an indoor public place or an outdoor public place, to wear a cloth face covering. There will be exceptions for very young children, people who are developmentally unable to wear a mask consistently, folks with underlying health and breathing conditions, which would make it unsafe to wear a mask. And that guidance will all be put out on Friday, and the executive order will become in effect on Friday. But I'm telling you on a Tuesday so you can start to think about it. And if you haven't had a chance to grab a bandana or a scarf or make a face mask, now's the time to go out and get yourself a mask. I'm sure many of you will have a lot of questions about this. Do I have to wear it when I go for a walk alone? Do I have to wear it when just my kids and I are in the park? So let me give you this guide. You don't leave your house without your car keys or your phone or your wallet. So don't leave your house without your face mask. Think of it that way. Just keep it in your pocket. On your way out the door, whatever your routine is, whatever you normally put in your purse or your pocket, pop your face mask in there. And just don't leave home without it, as they say. Now, obviously, if you're going to go for a walk alone, if you're going to go for a run, if you and your kids are going for a bike ride, we do not expect that you will wear your cloth face mask. If you're out and about with outside in a wide open area with the people who you're with every day, then you don't have to have it on. Have it in your pocket, because you might run into a friend, or you might go to the park and it might be a lot more crowded than you realize, and you might find yourself within 6 feet of somebody else. And it's just the right thing to do to be a good neighbor and a good Rhode Islander to then, at that point, pop on your face mask. I fully recognize this is going to be awkward, strange, maybe some people think not necessary, and there's going to be 1,000 what-ifs. Do I have to wear it? What if? Do I have to wear it? What if? So let me just give you this guidance. I'm going to tell you what I know. I know that the virus spreads very quickly. I know many other cities, countries, and states have gotten into really bad situations with overwhelmed healthcare systems when the virus ran away from them. I know we're going to be putting our foot back on the gas and letting folks get back to work, and we're all going to be around people more often. And I also know that if you cover your nose and your mouth, it does have a significant impact on reducing the spread of the disease. So in light of all that, I need you to do your very best. I need you to have a mask with you, be prepared to wear it, and at any time, if you're within 6 feet of someone who you're not otherwise in contact with constantly, you should put it on because it'll prevent the spread of the disease and it'll keep us as a state of Rhode Island safe and healthier. If you don't have a mask, you can go to cdc.gov for a tutorial, and this doesn't have to be fancy. Sometimes I just grab a scarf, and that could just something to cover your face and your mouth. So today's Tuesday. Think about it, digest it. The official rules will be out on Friday. The executive order will go into effect on Friday. There will be exceptions. We're going to be reasonable and use common sense. But I need everyone to try. I need you to ask yourself, how can I nail this? How can I best be prepared so that if I am sick, I don't spread the disease to my friends or my neighbors or my colleagues? Okay, I want to talk a little bit about the supports that we are putting in place for our vulnerable communities. Last week I spoke about some of the triggers that we need to meet in order to safely reopen the economy. And most of us tend to focus just on the cases and the trend in the cases, the trend in the hospitalizations, mortality, and the like. And that's important. But actually that's not everything. It's not even close to everything. I need to make sure we have a whole system set up, systems in place, so that when we reopen the economy, and we do see more cases, which is inevitable, that we can deal with it, so that we never again get into a place where we have that horrible spike and the virus runs away with itself. One of those measures is that I need to make sure that we have enough support in place for our at-risk communities, vulnerable communities, low-income communities, the undocumented community, communities where people live in very tight quarters, the homeless community. You know, there's a long list of people who are vulnerable, and we have to really keep our eye on that to make sure that our system is strong and structures are in place, and we're prepared for long-term support. This is a marathon. Until we have a vaccine, this is absolutely a marathon. So I want to share with you what we're doing on this score. In the past 2 months, we've set up 6 different housing sites, totaling over 1,200 beds, to provide people with a safe space to quarantine and to give healthcare workers a safe place to rest. As I've mentioned, Brown University has very generously donated use of 700 dormitories. Numerous hotels have partnered with us. Other agencies are partnering with us. Thank you, thank you, thank you to all of you for your partnership. But if you're hearing me say this, and if you're a healthcare worker who lives in a crowded apartment and is afraid to go home and sleep at night because you don't want to spread your germs, let us know so we can get you a free, safe place to stay. And I'm hearing this from a lot of mayors, Central Falls, Providence. So help us get the word out. We have over 1,000 rooms, and they're there to be used to keep the whole community safe. In the past 2 months, we've worked with big box stores and local retailers to bring their businesses online and increase curbside pickup and delivery. We've made it easier for restaurants to offer grocery items to consumers, and our local farmers and fishermen to sell directly to Rhode Islanders. I also want you to know that throughout this crisis, I have tried at every step to use local, to buy local, to support local farmers, local fishermen, local grocery stores, local vendors, because so many Rhode Islanders are out of work that any chance I can get to put people to work and support the crisis and support Rhode Islanders, that's the approach that we've been taking. We've delivered more than 26,000 meals every single day to Rhode Islanders and nearly 3 million pounds of food through our food bank. Now, I want you to know, you might say 3 million, is that a lot? Sounds like a lot. That's an increase of 40% over this time last year. That means a lot of our friends and family and neighbors and Rhode Islanders are struggling to meet their most basic needs, including feeding them and their kids. Through the food bank, we've trucked in over 300,000 non-perishable meals since early March. In fact, we were the first state to actually do this. And we're in very close contact with the food bank. They're unbelievable and doing a great job, but the needs are very high. So again, if you're one of the lucky ones who still has a job and doesn't worry about food security, if you can, make a donation to the food bank, because they're doing amazing work. We've also worked with our federal partners to open up home delivery of groceries for families on SNAP and get more EBT benefits to families who need it most. My goal from the beginning of operating in this crisis has been speed to execution. Time is our enemy as we deal with this virus. So, you know, we obviously have discipline and transparency, but speed matters. A day, a week, 2 weeks is a big deal. And we've been trying to get the information and resources to the people who need it and do so quickly while they're in need. These systems are going to stay in place through the long haul to get us through the end of this crisis. Our partnerships with organizations like the Food Bank, the United Way, Meals on Wheels are great examples of this. And if you're a Rhode Islander who's depending on the United Way, the Food Bank, Meals on Wheels, Family Service, etc., I want you to hear from me. We're not going to pull up the drawbridge in a month or two. We're in it with you, probably for the next year, and we're going to make sure you have the support that you need. The food bank is serving as a hub for emergency food distribution statewide, and that gives us the ability to track real-time inventory, hoping to stay in front of the need. The United Way has increased its staffing levels and strengthened processes, which allow us to track how many people we're serving and do our best to quickly meet their needs. We're also taking an aggressive and proactive stance to help people be safe during quarantine and make certain that survivors of violence know that there are resources available. I want to be clear, this administration has a zero-tolerance policy for domestic violence of any kind. Abuse and neglect of your kids, abuse and neglect of one another, abuse and neglect of the elderly. I know this is a desperate time. I know tempers are running high and patience is short. I know you're struggling. Violence is not an excuse. It's not acceptable, and we are going to do everything we can to make sure that if you are a victim of that kind of violence, you have the support that you need. And I'm asking teachers to keep an extra close eye on these kids. You know, normally kids see their teacher every day. A teacher is often the first person who could see if a kid is off, a kid's neglected, coming to school in dirty clothes. So we're trying to implement this kind of screening in our distance learning. And I also hope that once folks start to see their pediatricians and primary care providers more regularly, that's another place for kids to reach out for help. For now, I do want you to know we've developed resource materials, and we have a Safe at Home website to let people know they're not alone and there is help available. And the state police is doing a fantastic job doing daily book readings to kids in their homes, reaching out to kids. If you're out there and you're hearing me and you feel unsafe in your home, call us, go to the Safe at Home website, call domestic abuse hotline, call 211, just get yourself help, because we're here to help, and it's not okay if you don't feel safe at home. In the days ahead, we're going to continue to ensure there's a strong safety net in place for Rhode Islanders that's easy to find, easy to use. We're also going to be developing a one-stop app to provide all resources and supports that Rhode Islanders need. I think tomorrow I'll be talking more about our testing and our contact tracing, and we're going to be relying on what we're calling a one-stop coronavirus app. It'll be a single place you can go to on the internet, on a computer, on your phone, where you can have access to all the information that you need to keep yourself safe. And we're going to continue to rely on technology wherever possible, as we've done from the beginning. To that point, about 6 weeks ago, we started a partnership with a company called Nextdoor.com. If you haven't used it already, I'd encourage you to check it out, Nextdoor.com. It's really just a way to connect us to our neighbors, to know who our neighbors are who need a hand, and also for us to reach out if we need help. I want you to know that well over 100,000 Rhode Islanders are active on Nextdoor.com, and I think that's fantastic. That's how a lot of our elderly folks are getting checked in on, people who are homebound or getting a neighbor to look in on them, people who are sad and might need a friend. Like, this is a time to come together as a community. We are strong, we are in a good place dealing with this. We will be stronger if we come together as a community and help each other, as we've been doing. And Nextdoor.com is just one way that you can do that. We're working with senior centers to offer virtual programming. We're working with our churches and community organizations. They have been absolutely instrumental, all of them, in getting food and supplies into the hands of their followers who need them. Mayors and town managers have been fantastic. Community by community, I have seen people, businesses, leaders come together to help one another. And what we are trying to do is just build the systems so there's a statewide system, support system in place to get us through for the long haul. Lastly, I want to make a note about state government, back on this theme of what's opening in phase one, what can we expect, and where are we going? Obviously, as you know, state government has remained open throughout this crisis. And I do want to pause for a minute to thank the thousands of dedicated, hardworking, brave men and women who are in state service who have continued to work each and every day of this crisis. Many of whom are anxious, have been afraid, have a lot of questions, and still are doing the right thing and working every day so that we can serve the people of Rhode Island. And I have to say I've never been more proud of the state employees who work here. They are getting it done, and they're doing a terrific job under difficult circumstances. Here's what they can expect and you can expect in the first phase of opening. For most state employees, which is also true for most office employees, their life is not going to change in phase one. We've enabled thousands of people who have office jobs to work from home. So in phase one, they're going to continue to work from home, as should you if you are able to work from home. For those employees who must come into the office because they just cannot perform their job duty at home, then we'll be following public health guidance. Everybody will have to wear a face covering. It'll be provided to them if they can't get one. We all have to keep 6 feet of distance while we are at work, practice proper hygiene, wash our hands, extra cleaning protocols, and the like. For the customer-facing services like Health Source RI, Department of Human Services, Department of Labor and Training, we're going to continue to serve the public, just as we have in phase one, through call centers and online services. So DHS field offices are not going to reopen in phase one. DLT, all of this has been working quite well online, over the phone, with call centers, and that's how we're going to continue to operate through phase one. We are planning to take incremental steps in the spirit of slowly and steadily toward expanding some services to the public in phase one. So today I'm announcing we're going to reopen a little more in-person DMV services by appointment only in phase one. Currently, only the Cranston DMV site is open, and that's by appointment only. And we've been hard at work putting in extra protection measures like plexiglass for customer service windows, mask wearing in the satellite offices. We're going to try to reopen one satellite DMV office later in phase one. And then beyond that, everything is still by appointment only. So why am I saying that? Because that's how I want you to think about phase one, which is very incremental for these next couple of weeks, while we're getting the hang of living this new normal, and let's make sure we know what we're doing before we scale. So with that, I will turn it over to Dr. Nicole.
Thank you, Governor. Hello, everyone. Happy Tuesday. I want to take a moment to really reiterate the science and public health rationale behind the approach we are taking to masking in Rhode Island. As the governor has mentioned and fully understands, and as we have shared with you, this virus spreads between people who are in close proximity to each other. When we are speaking, when we're coughing or sneezing, symptoms, or even sometimes people without symptoms, can cause spread of this virus, particularly when we are close together. It's important to know that just one single cough can result in a person spreading 3,000 droplets. And the droplets are what the virus can be carried in and land on surfaces and other items or on people if you're close enough. What's key to understand is that the mask, some form of covering over your face, your nose and your mouth, helps in stopping transmission of the virus from one person to another or from a person to another object. So as we have shared, these cloth face coverings or cloth face masks allow for you to protect the people that you are around in public. It's important to know that the masks or the coverings do not mean that if you have symptoms, you can go out into the public. That is not changing. The masks are not helpful for stopping transmission completely if you actively have symptoms. We want to make sure that you stay home and recover safely there, call your provider, and get tested if you have symptoms. Now that we are going to requiring some form of covering over your face, it does not mean that you have symptoms and it's still safe for you to go out. I want to make sure that that message is clear. I also want to talk about the fact that there are people who have COVID-19 and don't have symptoms. We sometimes use the term asymptomatic to describe those people. That's why it is helpful for everyone to wear the mask, particularly when you're out in public without any symptoms, speaking, sneezing, anything that you may do that can cause droplets to occur. Wearing some form of covering over your mouth and nose can help significantly in stopping the unknown risk of transmission in some people who may not even know that they can transmit because they don't actually have symptoms. A cloth face mask or cloth face covering, as the governor said, it could be a scarf as long as it's covering your mouth and nose, acts as a physical barrier to protect the people around you from the thousands of droplets that I talked about. So it's especially important in places where it is more challenging to do social distancing. For example, in public places, in the grocery store, or some other place that you have gone to in public. And particularly in our communities where it is more dense. So walking around in Providence, there's a much higher chance that you're going to come across someone even just passing outside on the sidewalk. It's important then to be able to have that physical barrier of a cloth face covering. Though I think we're all getting a little more accustomed to it, wearing a cloth face mask or cloth face covering or seeing people in cloth face masks might be a little scary across the board for seniors, for kids, for other adults. One thing that we want to continue to do as we move forward with this is to personalize it, make it a new part of our way of being in Rhode Island. We know that it's effective. Let's embrace it together and get creative in how we are talking about it, how we're communicating with each other and engaging with each other, figuring out ways to make decorations or designs on your masks are helpful ways for all of us to adjust and recognize that this is a new way of being for us in Rhode Island. When I see people out in the community wearing a face covering, I see people acting to protect their fellow Rhode Islanders. That's actually what we are saying now when we use some form of cloth face covering. We're hopeful that this executive order today will give people a little more clarity on cloth face masks, so Rhode Islanders can keep doing a tremendous job as we look forward towards our steps slowly reopening the economy. I do want to make one last point about cloth face masks. When we make policies at the state level, there are usually people who are going to need exceptions for very specific reasons. There are going to be people of all ages who can't wear cloth face masks because of medical reasons, or because of developmental reasons, or for other reasons. We want to make sure we acknowledge that, and we still embrace those members of our community while encouraging everyone else who can to do what they need to help protect others by wearing some form of covering. It's not going to be helped if we use this as a way to turn on each other in anger or with rudeness if you see someone not wearing a mask. But now is the time to be able to support each other in being able to do it. Go to the cdc.gov website, learn how to make one for yourself, and support each other in following the rules. That's what we're always saying, figure out ways to follow the rules and work along with this. In terms of data for today, we have 208 new cases. Things certainly can change, but the relative stability in this number is something we are considering encouraging. There are 327 people currently hospitalized. Of those people, 89 are currently in the intensive care unit and 62 are on ventilators. These numbers have also been relatively flat. Sadly, we have 14 new COVID-19 associated fatalities to report. These people ranged in age from their 50s to being older than 100, one person in their 50s, 3 people in their 60s, and 1 person in their 70s. Everyone else was 80 years old and older. And I want to be able to say, because it's important, that our deepest sympathies go out to the families of these 14 people and to all people who have been lost in the last weeks and months. So with that, let's get started with questions.
Good afternoon, everyone.
Hello.
We're going to begin with Scott Isaacs from NBC 10. Governor, he says, what do you think if some mayors, like in Providence, do not want to begin reopening this weekend if you lift the stay-at-home order?
Yeah. So it's a good question. It's a tough call. I'm in touch with the mayor of Providence constantly. Our teams are talking pretty much every day. On the one hand, I'd like to see uniformity across the state. It's a small state. And I think it creates confusion for the citizens of the state to have to be following different rules. So I'd like to see if we could get to a place where we get aligned. Having said that, we also know that this disease really does vary. I mean, you can see it even in the statistics on the screen. Providence and certain communities in Providence and certain neighborhoods in Providence have a very different picture than westerly. So every mayor, like every public official, has to do what they think is the right thing to protect the people in their city. So the long-winded way of saying, if it comes to that, I'll respect it, but, you know, I'd like to try to work so we can have speak from a unified place.
Alex Weldon of WPRO notes, reportedly, Rhode Island garden centers are using Massachusetts guidance for operations in lieu of an update from you. This is also their biggest selling week of the spring. Do you care to comment on this?
Yeah, that surprises me. DEM put out new guidance yesterday, Monday, and they've been providing new guidance. So I will triple check that that is the case. We absolutely want the garden centers to be in business and to be selling. So check out the DEM website, and I promise I'll check this afternoon.
Our next question is from Bill Bartholomew. This is for Dr. Alexander Scott. When will you lift the referral requirement for testing sites, particularly in those communities where a sizable amount of people don't have a primary care doctor? Further, have you considered Dorca's offer to provide translation services at these sites?
Excellent questions. We are actively working on ways to adjust to the community's needs. We recognize that not everyone has a provider, and thanks to the advanced and accelerated work of the technology group, we are looking at how we can have the technology support our ability to make sure people with and without access to primary care providers can get tested and then hopefully get connected with a primary care provider as well. So we are actively working through that as we speak and look to have a tech-supported approach at being able to address that soon. We certainly recognize the importance of having translation services available. So we always value partners such as Dorcas and many others, and want to absolutely work with them and others within the communities to make sure that the services people need for each community are available to them, such as translation services. So that's the work that the governor referenced that we are moving and working very hard towards.
Our next question is from Alexander Leslie of WPRI Channel 12. What is the current status of the state's supply of PPE as we prepare to reopen the economy? Has the recent collaboration with other states to acquire gear have been more effective than without?
Well, that's a collaboration that I just announced on Sunday, so we're still figuring out exactly how to operationalize that, but I'm confident it will help us because it just makes sense to be working with other states instead of competing with other states. The supply is stable. You know, listen, it's not where I would like it to be. You still hear from certain nursing homes that are struggling, hospitals, you know, still having to do a lot of conservation. So I hope it to be better as the supply opens up all around the country. But it is stable. We no longer have shortages. We are, by and large, able to meet the needs of all our healthcare providers. And now we are moving into a place where we want to be able to supply surgical masks for you know, more of our allied health professionals as we start to let them to open up.
Our next question today is from Christian Winthrop from the Newport Buzz. I'm hearing from lots of seasonal residents who want to come home to Rhode Island. How long do you envision the mandatory 14-day quarantine to remain in effect?
So later this week, probably Thursday, I'm going to be addressing travel and new restrictions for phase 1 on what travel will look like. However, I anticipate that 14-day quarantine to remain in effect for phase 1, and it is in effect now. I realize it's an inconvenience. If you have a second home here, we would love for you to come here, but at this point in time, the 14-day quarantine, which means you just have to stay in your house, is in effect.
Ted Nisi from Channel 12 asks, with the scope of the state's unemployment fraud problem coming into focus as a significant issue, will you have the state pay for credit monitoring of those who've been victimized, maybe out of the $1.25 billion from the feds?
Yeah, so first of all, let me say it's not at all clear that it is a significant issue, or let me say, we're still trying to get our arms around how significant it is. I mean, $1 of misuse of taxpayer money is a serious problem, but to answer your question, I would say we're still trying to get it to come into focus, and there's just a lot more that I need to know about it, the details of the situation, before I can answer your question around what we might do about it.
John DePietro asks, since golf courses are open, can golf driving ranges open on Saturday? Also, can you touch on the thoughtful video by Father Talon regarding the number of people allowed to attend a funeral compared to Massachusetts and Connecticut? Why is Rhode Island no more than 5 when Connecticut is 25?
Okay. We're going to be announcing, let me back up. So unlike a lot of states, I never closed golf courses. We have been allowing golf throughout. On phase 1, starting hopefully next week, there's going to be phase 1 guidance for golf courses. So if you could just hang on for a couple of days, DBR will be putting out new phase 1 guidance for golf courses, which will address driving ranges, carts, tee times, etc. So you'll know before Saturday. I'm sorry, I didn't see the video. The answer to why is Mass and Connecticut doing it differently, again, every governor is trying to do what we feel is in the best interest of the public health and safety of the people in our state. So, we're all doing our best. We're all a little bit different. I have been strongly advised, urged, pleaded by my public health advisors to keep it at 5, and so I've kept it at 5.
Bruce Newberry from WADK in Newport asks, what standards of cleaning or sanitizing are you considering for restaurants so they can make guests feel safe? Might there be state certification training such as tips or a food safety license? Procedures such as documenting cleaning procedures on a regular basis?
It's a good question. So let me give you a flavor for how we're thinking about it. In the new economy, there will be certain things that will be guidelines. And you started to see that yesterday. By putting out those pictures yesterday, I was hoping folks who own a retail shop could take a look at the pictures and have a guide of, what their new life is going to look like. And certain pieces will be the new law, right? Like making sure people don't come to work sick may be a requirement. Whether you do that by taking someone's temperature or just have a check log when they come in, that's the kind of thing we'll probably leave up to business. Same thing for cleaning. There'll be a certain amount of it which is compulsory, you have to do this, and then others of it, we're going to have to let businesses have some flexibility to figure out what's in the best interest of their, how they can practically comply with the law. So this is the work that we're doing right now. And later this week, restaurants I won't have guidance for this week because that's a phase 2 effort, but we will have clearer guidance in a day or two for retail and for offices and such to answer questions exactly like that. But just so you understand, and if you're a business person out there, I'm trying to walk a balance between requiring what is necessary to keep your employees safe, give your employees confidence, and prevent the spread of the disease, and also give you some flexibility so you can effectively comply with the new law.
Amanda Milkovitz of the Boston Globe notes, White House guidelines recommend a drop in cases and symptoms for 14 days, but Rhode Island hasn't seen that. She questions, will you reopen anyway? Which guidelines have been met?
Yes. So as I said a week and a half ago, our guidelines here are going to be a decline or a plateau. And I do realize that that is different from what the White House said. Having said that, I just put the data out the other day. We're still learning about this virus. We could be in a plateau for an extended period of time, which means that we could be in a place where the spread of the disease, or what sometimes people call the R naught, is at 1 or below 1. in other words, safe to reopen, even though we're in a plateau. So every day, as I did this morning, I talk to hospitals, I consult with Dr. Nicole and her team, we look at the model, we talk to the experts, and I laid out 6 criteria, and one, as it relates to this, we have said that a 14-day plateau is acceptable. As for the other guidelines, I'll go through, if you want, I can go through one by one. There's the PPE guideline. We have to have, what we need is a number of days on hand. We have to have our testing in a place where it hits certain metrics. Everybody who has symptoms should be able to get a test within a day. We ought to be able to complete our contact tracing with 48 hours. We ought to be able to get to a hot spot to do testing within 4 hours. So that's the testing metrics. We have contact tracing metrics that I just explained. We have to be able to take care of the vulnerable. So we're going through an extensive checklist, and if the guidelines have been met, then we'll do the reopening, and if they haven't, then we won't.
Alan Gabberty from WBOB asks, yesterday there were reports of a helicopter hovering over a Pawtucket cemetery, presumably counting mourners at graveside services. Can you confirm this? And what surveillance technology is being used to monitor crowds? Will the governor relax crowd restrictions in phase 1 regarding funerals?
I cannot confirm that because I am not aware of that. And crowd, I'm not sure. We're still deciding the number of people that will be allowed to get together in a social gathering in phase 1.
Our next question is from Richard Asanoff of Convergence RI. What are the biggest problems you see with the flow of information around what is happening with the response to the virus?
I think there's a lot of there's a lot of fear-mongering happening. So that's a problem if it's based on poor information. On the flip side, there's a lot of misinformation flying around that, this has all been a big overreaction and we can just go back to life as normal. So I think the best advice I have had for people is to tune in here, to follow what's on the CDC website, to follow what's on the Department of Health website, and just, go to official sources to try to get your information versus all the stuff that might be flying around on social media. Having said all of that, things are changing. I mean, one of the things that makes this a hard crisis to lead through is we get different, things change, and as conditions change, as information changes, as our knowledge of the virus changes, as therapeutics change, we need to change with it. So the best advice I can say is, like I said, stay tuned to kind of official sources and keep yourselves informed.
Ron St. Pierre from WHJJ has our last question today. Does Friday's executive order allow businesses to deny customers entry if they're not wearing face coverings, and does it apply to drive-through?
It will definitely apply to drive-through, certainly apply to drive-through, and we are still crafting the executive order. So to be crafted, which will be released Friday. Penalties, what will be the civil penalties? There'll be fines. We're figuring out exactly what, exactly who's excluded, as the doctor was explaining, and what your question falls into the penalties. Again, I'm trying to strike a balance between you want compliance, you want everybody to do this, but we don't want to be overly heavy-handed. Having said that, we want to get compliance. So it'll be online on Friday, but it will definitely apply to drive-thrus, and that's something where we're seeing a lot of problems. If you're in your car and you're leaning over to pay for your coffee or whatever, you're within 6 feet of that customer service representative, and it's really not fair to them if you don't have your mask on.
Thank you very much.
Thank you.